Do you train Brazilian Jiu-Jitsu and suffer from elbow pain on the inside of your elbow? Watch this video for a deeper dive into learning how to manage your medial epicondylitis. So today we're talking about a really common injury in BJJ. It's got a lot of names, but it's most commonly known either as medial epicondylitis or golfer's elbow. And it tends to manifest as pain on the inside of the elbow. It's a part of the body known as the common flexor tendon. And the most common symptoms are just really sensitive to the touch in that part of the elbow. And it's also normally exacerbated by movements where you have to grip and pull. So doing something like a pull-up in the gym, or maybe a bicep curl, or grabbing onto someone's gi and pulling them towards you. Now, if you're in the earliest stages of dealing with this injury, I recommend you first hop over to my shorter video where I give 3 very simple but effective strategies in managing the earlier stages of this type of injury. However, if you've already tried that simple protocol and the injury is still with you, don't worry, don't panic. You can still manage this injury. It's just going to take a little bit more detailed thought and consideration, so this is the video for you. So golfer's elbow is a really common overuse type injury. So that means you didn't do anything acutely or traumatically to injure it. You didn't tear anything or fracture anything or anything like that. However, you have put an abnormal amount of load through that common flexor tendon, and over time it started to have some problems. It could probably handle things at first, but now it's telling you enough is enough and you need to do something about it. So the first step, winding things down and reducing inflammation. So to wind things down, I would recommend you continue with that SSS protocol I outlined in the other video, the smash, strengthen, and stretch protocol. However, when that isn't fully resolving things, I would recommend adding the following 2 steps. Firstly, that thing nobody wants to hear, you might have to reduce your training load for a short period of time. Now, generally, you don't have to stop training entirely with this sort of injury. However, you do need to cut out or at least significantly reduce any exacerbating activities. So I would highly recommend, if you are doing any weight training or gym style training, eliminate just for a while, a couple of weeks, any pulling type movements, rowing, pull-ups, lat pull downs, that sort of thing, bicep work, forearm work, and grip work. Eliminate all of that from your strength and conditioning or gym program, especially if these activities are painful or exacerbating your condition. You don't have to eliminate these activities forever. And in fact, once you're past a certain stage of rehab, bringing them back into your program is a really good idea. But if you're particularly acute and in a particularly painful stage of the injury, you need to reduce these exacerbating activities in order to wind things down. The second tip I'll offer, which tends to work surprisingly well, is use a period of time to focus on techniques that don't rely so heavily on your grip. Think of it as an opportunity to work on other techniques while you're allowing that medial elbow to chill out a little bit. And of course, if you're someone who likes doing a lot of no-gi, think of it as a prime opportunity to focus a little bit more on that. Obviously, no-gi is far less reliant on grips in their training and techniques than in the gi. So it can be a nice alternative while you are rehabbing your golfer's elbow. The second step is to utilize some sort of anti-inflammatory protocol. So the itis suffix, part of a disease name or injury name, appendicitis, conjunctivitis, medial epicondylitis, indicates some sort of inflammatory process. Now, it is true that more recent research indicates there isn't always inflammation associated with this injury, golfer's elbow. However, there often is. So usually some sort of anti-inflammatory treatment, NSAID type medications, ibuprofen and so forth, or even topical ibuprofen gel, things like that can work really well. Now, of course, I'm not a doctor and I'm certainly not your doctor. So all medications need to be taken in conjunction with medical advice. I'm just speaking here generally to the injury itself and what I know usually works well in clinic. So that's the first part, winding things down. The second part is to find what is causing the abnormal loading and fix it. So what I usually see in persistent cases of golfer's elbow in people who do BJJ is that it's normally secondary to some sort of shoulder dysfunction. So things like limited shoulder stability and mobility can lead to compensatory movements and altered mechanics in the muscles of the arm and movement at the elbow joints. And these compensations can place an abnormal stress on that common flexor tendon, contributing to the development of golfer's elbow over a period of time. Addressing these underlying shoulder problems through targeted rehab exercises is essential for preventing golfer's elbow from becoming a chronic, long-term issue. If you want some specific advice on how to manage shoulder dysfunction, you can check out my videos on that topic. I have a whole playlist of exercises that can help you manage your shoulders and get them stronger, more stable, and more mobile. If you have any questions or suggestions for future videos, please leave them in the comments below. I'm here to help you train harder for longer and, importantly, as pain-free as possible.